Johnell, you're up. Thank you and welcome.
Hello, hello, hello. Can everybody hear me? Am I coming through all right?
Yes, yes.
Wow. I'm just going to take a moment to just invite my ancestors in, the voices of my teachers and my guides and my mentors in. I'm just blown away by this space that has been created, that I have had the ability to witness and experience throughout the day today. Initially, when I woke up this morning, I woke up with the idea that I was going to have this beautiful slide deck and I was going to highlight all the bullets of 988. And sitting in this space with you all, I recognize what is important and how important it is to just be telling our stories, be sharing our experiences, be sharing what it is that we do and what we bring to the table. And also, what I was really overcome by was the overwhelming reality of how important each of you are to the overall care continuum to the communities and populations that we are part of and those that we serve. There was a moment during the morning where I was listening to some stories being shared in the space, and I thought about this quote by Cornel West saying, "Justice is what love looks like in public." And I felt it in and through my body. Being able to witness folks telling their stories, their experiences of hope, their stories of pain, the stories of success and thriving, and overcoming multitude of barriers. And what I understood in these moments was that it was in being able to witness all of this is that I recognize that in those moments, we give other individuals the opportunity and the permission to do the same for themselves. And how each of you today has been a powerful example to me and to the work that I hope to continue to do one day at a time. Again, I'm just gonna quick start off. My name is Johnell Lawrence. I use pronouns like they and he. I'm the Director of Equity and Belonging for Vibrant Emotional Health, who has been tasked as being the administrator for the nation's new 988 line. Like I said, I came here today thinking I was going to do this whole spiel about 988. What I really want to talk about is crisis care continuum, its expansion, its needs, and the desire to collaborate ongoing with folks like yourselves. And one of the other things that pushed me to scrap my slides is, and Antoine, I appreciate the little nudge around like academia and experiential. And thinking how important it is that whatever we're doing, ensuring that our process is equal to the outcome that we're seeking. If the process of my work is to desire for folks to feel like they belong, that they are included, I should be a part of the process that makes the messages accessible, thoughtful, intentional, and impactful. When I took the role as Director of Equity and Belonging for Vibrant Emotional Health, I thought it was very interesting that the role wasn't, Director of DEI, much of what we see in so many spaces. I was really struck by the term belonging. A lot of work in a lot of spaces, a lot of organizations is really focused on diversity, diversity, diversity. What I've come to find out in the years of the work that I've done is diversity is really about numbers and checking boxes. Belonging is about impact. How does the work that I'm doing actually impact and enhance the lives of those I say that I am here to serve, care for, support? Whose outcomes am I tasked to enhance? And I feel really grateful to be a part of an organization and walk side by side with a team that I feel like really embodies those values. In the space today, I heard a lot about historical and current persistent harms. And much of our work, many of us are very aware that Blackness, transness, queerness, those identities can serve as a pathway to houselessness, carceral impacts, poor and undeserved health outcomes, mental health outcomes, having bodies that are over-policed, always having to think about how I can show up today to ensure that I can be able to show up in this space again tomorrow. Having to leave parts of myself outside. So if I'm thinking about love, I'm thinking about justice, I'm thinking about care, I'm thinking about the roles of mental health care, support, crisis and emotional care response, suicide prevention, and thinking that all of these things are a part of prevention. All of these things are a part of care. These drumming circles. I heard a beautiful talk in the last session from an individual from Simmons University, and I was really moved by the words that I heard. During that lunchtime panel, where I believe the individual was named Dr. Coleman, I literally had to sit back and let my body feel the feelings that I was feeling. Because much of our work doesn't embed, but needs to embed the impacts of historical and persistent racialized trauma. These are the pieces that get missed in a lot of our work when we're thinking that many of the work we do is a one-size-fits-all package. 988 is not the solution. It is a part of a growing and expansive solution towards care and prevention that needs as much help, support, and collaboration to ensure that we expand and diversify this crisis care continuum to really meet the needs of all people. I quick want to give a little love and shout out and gratitude to the team that I get to work side by side with. Because I even heard stories today of individuals who have felt alone in their process, in their practice. And I feel really grateful to, and I say this to the team all the time, to feel like I'm walking side by side with giants. And I say, whatever work you're in, wherever you're at, whether organization, community group, if you're an individual social worker, therapist, find a community, find a crew, because this work is a lot to hold by oneself. And think about how much that will impact your own body, thinking that it's up to you all by yourself to affect change. Lean into the brilliance around you. And the brilliance I get to lean in around me every day, these folks go by the name of Lisa, Sauda, Mel, Damon, Mihia, Uma, Jeremiah, Madeline, Natalie, Haywan, Caitlin, Nakaya. I think I hit everybody. If I didn't, I'm sorry. But what's important to acknowledge is that I'm not going to step into this space today and act like I do all these things by myself. That is a supremacist tenet. I can't show up in these spaces without the care and support of a multitude of individuals. And the people that I get to work side by side with, not only am I grateful to work with them, but I am grateful to learn with them, unlearn with them, expand with them, and pull for change with them. The Division of Equity and Belonging at Vibrant Emotional Health, who I said has been tasked with being the administrators for 988. Our role is really full-on disruption. Disruption in how we communicate, how we gather data, how we share information. Constantly thinking about who's not here, how do we get them here? Always overarching, looking for new opportunities to collaborate, to enhance policy. I am in a crew of solid people committed to not knowing that change isn't going to happen tomorrow, but change will only happen if we keep on showing up for it one day at a time.
My husband calls me and I thought he was going to say he wanted me to go back to the mall tonight.
Thank you, Diana. Thank you.
Oh.
It's all right. And here's another piece, right? We all show up the best we can one day at a time. Whatever your best is today, however you're showing up in your lives and your relationships, at your job, each day, whatever your best is, it might be different than it was yesterday, it might be different than it was going to be tomorrow, but your best today is exactly that. And that's part of also diversifying what healing and care looks like. Being healed, being cared for does not look one way. These ideals of what we say, what a healed person looks like, what a healthy person looks like, that all has to be disrupted as well. This summer, with a partnership with SAMHSA, 988 was launched on July 16th. 988 is a 24/7 hotline and a web of 207 crisis centers throughout the nation and territories who have deep roots and connections with the communities and populations that they serve. And what I want to tell you is that 988 is not the first crisis and suicide prevention hotline. This work has been being done, but what 988 is a connector and an enhancer for crisis emotional support hotline services. With this, we are able to better ensure that no matter where you are in this country, 24 hours a day, someone can pick up the phone and reach someone to talk to. Talk through the pain, talk through the hurt, talk through the barrier. And hopefully then also get connected to some resources within community. This is why I elevate that this is just a part of the crisis care continuum. The work that you folks do is vital. Because after they hang up the phone, what services are they going to go to in their communities? What drum circles? What spiritual healers? What community centers? And when I think about it in the context of folks who are older and going through the aging process, in a time of multiple conflicting pandemics, epidemics, crises, we got racism, homophobia, transphobia, sexism, ableism. I mean, I can keep on going on. Xenophobia, xenophobia. Put that on top of COVID-19. And put that on top of our growing climate crisis and issues with environmental justice. With a person in New York City who might have more access, doesn't mean good access, doesn't mean it's the best of everything, but with more access, it's another piece. But think about our elder, our trans elder in rural Kansas, who was living through these competing crises in isolation, witnessing harm on social media, on the news, seeing attacks against identity, questioning their worth. That person will have the ability to pick up the phone and call somebody. 3 easy numbers to remember, 988. A piece of the puzzle. Part of the work is also robust advocacy around embedding multiple resources in all communities. Things like mobile crisis teams, Things like ensuring folks understand the depth of healing practices within communities. Access to therapy is a social justice issue. And thinking that therapy is the only form of healing is a social justice issue. Part of the work of the team at Equity and Belong is really trying to advance an understanding across our centers what healing can look like to a multitude of people and disrupting what we think healing is, disrupting what we think care is, disrupting what we think is therapeutic. And we didn't wake up like this. We learned these things by being in spaces like this, by having conversations in communities, by learning from folks who have said, to hell with the government, I'm gonna set my own thing up for the people in my community who are in dire need of a diverse pipeline of resources. We're a team of learners. We're a team of unlearners. Because I like to say all the time, as a Black trans person in the United States, I have been rained on by white supremacy my entire life that I don't understand and always acknowledge how wet I am. And if I'm not actively working against it, it is actively working on me and through me. So part of our work is not just pushing and pulling for change within the crisis care continuum through 988 and our direct services programs, but also interrogating ourselves one day at a time. You know, when I think about impact, when I think about care, I just constantly think about how much more there is that we need to do. But then I hit spaces like this and I realize how much is already being done and how can we connect it. So I'm leaving this space today on fire. I have to tell you, y'all have lit me up. Y'all have inspired me. Y'all have tasked me with new charges. Thinking about 988 and how it can enhance the lives and the care of LGBTQIA plus, two-spirit, older adults. And thinking about how do I get y'all in? How can I get to talk to you? Because in a lot of our work, when we think about the future, we instantly go to the youth. When we think about the future, we don't think about the folks who are already ahead of us, who are living and existing in a way that they need the vital supports that they need so that when we get to be that age, we have what we need. The future has to be both ways. Because if the older adults don't have what they need, how can we ensure that the younger people have what they need? Everybody has to matter. Recently, 988 has launched an IVR for LGBTQIA plus youth. And we saw a hot tick up in text and chat and phone calls amongst our young people. And the goal of this process is to, over the next year, expand this service to include all LGBTQIA plus folks over the lifespan. But me, myself, and our team cannot do it by ourselves. So part of our process, because equity is also about process. I can't say I want an equitable outcome and the process be flawed and supremacist and power driven. We have to get as many voices to the table. So what we have done is, and what we're working towards is having folks, young people, folks from the aging community, folks who support the caregivers and families of LGBTQIA+ folks, researchers, activists, folks who work in treatment centers, to ensure that we are mitigating harm and enhancing the possibilities of the beauty that I hope the care for folks to receive when they call this line. The goal has to always be collaboration. We can only do but so much by ourselves, but what we can do together, family, let me tell you. In the state of Washington, we are set to launch an IVR specifically for folks of tribal nations and indigenous populations. Interesting thing, Washington did this for themselves. They got the funding, they set up the line, and all they asked was to be a part of the growing 988 network. So that way, that whether a person calls their Native and Strong line directly or calls 988, a person from a tribal nation, a community, and indigenous communities will get the service that meets their needs. Part of 988 implementation is not about, we launched it, it's done, and there's no more work to do. Part of the implementation is expansion. And so what I offer to the folks on this line, folks who are in community, folks who have training curricula, folks who would like to speak more about what they're hearing in communities regarding 988, regarding mental health care continuum, reach out to myself. Inbox me, hit me on this, and we can see what kind of opportunities may have to collaborate and to have the voices and experiences and feedback of those served embedded into the work that we do. As a person who has worked in public health and other nonprofit organizations, I know the harm that happens when we just survey community, never go back regarding the results, nor do we embed the feedback into the work that we're doing. The goal and the intention of our sessions with folks in community and other organizations is to actually embed this work. Again, like I said, we are not the inventors, we are not the creators, but we hope to be connectors and enhancers. And we can't do this by ourselves. We need y'all too. I'm a wrap up a little bit. You know, I went off script. I know that if y'all were looking for a 988, you know, presentation as to this is what it is, this is what it ain't, you know, I'm sorry, but I can get that to you as well. But most importantly, I wanted you to know that what I was able to experience being in community with all of you. Hello, Galaxy 812. Being in community with you all today, I was able to sit in a space of learner. I was able to sit in a space where I was grateful for the generosity of information and experience that was shared with all of us today. I'm grateful for, in my mind, for putting this all together and giving Vibrant and 988 an opportunity to participate, to share, to witness. And if nothing else, right, know that if someone in your life is having a hard time, if you're working in an organization, let folks know that 988 is here. If you would love to collaborate, please reach out. I thank you all so much for your work, for your service. We are here not working for ourselves, but to work with you and to work for and with community. Thank you so much for allowing me to be in space with you all today.
Thank you very much, Johnell. This is truly, valuable that you should be here with us to talk about Vibrant and 988. I think what was particularly important about you speaking about Vibrant is that you look like us. You got our skin color. You're part of our community, because we know that mental health does not often represent Black and people of color. We don't see ourselves and we do not identify with mental health. So the fact that you're here and can talk about this and can raise awareness about 988, that is an opportunity for us to reach out to get the help we need, because we do need help. And so thank you very much for sharing and speaking about this. And we do look forward to working and collaborating with you moving forward. So now, community